So I'm just going to take this covering off your eyes and just take a moment to allow your eyes to adjust to the light of the room, okay? There you are. So just take a minute. There we go. Allow your eyes to adjust. Okay. Good. In the meantime, I'm going to just apply a few little eye drops. Okay, just to help your eyes to feel a bit more comfortable. Okay. So if you'd like to look up for me, there we go. Good. Good. Okay. And do the other side. There we go. Just a few little drops. Look up for me. Okay. All right. Excellent. So I'm just going to gently wipe your eye for you, okay? All right. There we go. Okay, good. So how are you feeling? How are your eyes adjusting? Not too bright in the room? All right, good, good. So I'm going to check the surface health of your eyes, okay? Just one by one, and I'm going to be doing that by shining a little light like this into your eyes, okay? So whilst I'm doing that, I would ask you please to keep looking straight ahead and focusing on one of the patterns behind me on the wall, okay? So do your best not to look directly at the light because it is quite bright and I don't want to cause any further sensitivities. Alright. So let me just take a careful look. Okay. Good. Alright, so I'm just going to come a little bit closer and lift your upper eyelid. And if you'd like to look down for me. Good, very good. Okay, good. So I'm just going to lift your bottom eyelid as well. And if you'd like to look up for me. Okay, good. You can relax and blink. Good. Keep looking straight ahead. Okay. All right, good. So let's look at the other eye. So I'm just going to come a little closer and lift your top eyelid if that's okay. Just look down for me. Good, and you can relax for a minute. Good, and then I'm just going to lift your bottom eyelid, and if you look up for me, there you go. And that's it. Alright, and you can relax your eyes. All right. Okay, good. So I'm going to check the surface of your eyes using different tones of color, okay? It'll just help me to see if there are any tiny surface abrasions, any areas of infection, any dryness, anything that I need to be aware of, okay? Alright, so the first tone that we're going to use is red. So I'm going to place a red card, just like this, over your eyes, okay? Just gently. There we go. Alright. Good. And again, I'm just going to shine a light. Just to have a little look at how your eye responds, and also looking at the health of the surface of your eye. Okay, so just a little bit closer. Okay. I see, just checking the surface. Looking here at the response of the view. Okay. So I'm going to keep hold of the red light. Okay. And just look at the other side. So do your best not to look directly at the light. Okay, keep looking straight ahead. You're doing very well. Okay. Just here. Okay. All right. Good. Okay. So I'm going to remove the red filter. Okay. There we go. Okay. How is that? Okay, good. So we'll do one more. And the next filter that I'm going to use to test the surface of your eye is green, okay? So I'm just going to place this over your eyes. Okay, alright. And then I'm going to just shine my little light as before. Just look at the health of the surface of your eye. just look to your left for me. To your left. That's it. Very good. Okay. And if you look to your right. That's it. Good. Very good. All right, okay. Good. So I'm just going to remove the green filter, okay? And there we go. All right. So how is that? You doing okay? Good. Excellent. So I'm going to do a vision check. But first I'm going to just measure the distance between your pupils, okay? Just for my records. So if you'd like to just look straight ahead for me. Okay, just keep nice and still. Okay, good. And keep looking straight ahead. All right, good. Okay, so vision check. I've noticed that there's been some changes in your vision. So we'll do a check and then I will add a few lens options for you so that you can tell me which is better or worse, okay? Alright, so if you can take a look at this little chart for me, please. Okay. In fact, I'm going to switch off my main light so that it's easier for you to see, alright? So give me a minute, okay? I won't be long. So let me see here. Turn on this light. Good. So, taking a look at the chart for me, can you read that line? What about this one here? And what about this one? What about this line? And this one? Anyone on here? Anything? Okay, all right. Okay, so we're going to try again. But this time I'm going to add a lens, and I'd like you to tell me, okay, with the lens, if the chart is better or about the same. Is it better or about the same? Okay. Good. Let's try with one more. So would you say the chart is better with the lens or without? Better with the lens or without? Okay, good. Okay, so would you say it's better with one or two? One or two? Okay, do you want to try one more time? One or two? Okay, very good. All right, so I've made a note of that and we'll get your prescription updated. All right, good. So I'm just going to turn on my little light. All right, good. How are you doing? Okay. Excellent. Good. So I'm going to have a look at the health of your optic nerve, okay? So I'm going to be shining a light inside your eye, coming a little bit closer with my ophthalmoscope, alright? And it shouldn't be too uncomfortable, but if the light gets too bright, just make sure that you keep looking straight ahead, okay? Don't look directly at the light, alright? Okay, good. So I'm just going to test the reflex of the pupil. Good. Okay. Just checking that. Good. Okay. And I'm just going to come a little bit closer. Just a little bit closer. Just checking here. Looking for any sign, anything that I should be concerned about. Checking the health of the optic nerve. Looking here into the eye. Keep looking straight ahead for me. That's good. You're doing very well. Okay. Just taking this bit. Here. Good. Good. So you can just relax for a moment. Blink. So that side is looking healthy. Okay, so that's good news. And let's take a look at the reactivity of the pupil again. Just on this side of this eye. Okay. Good. going to come a little bit closer, if that's okay. Just have a look inside the eye. Okay, I'm just looking at the half of the optic nerve. Just everything is normal as it should be. Making sure that no anomalies, no additional concerns, no additional tissue irritations forward. Okay. So we're almost done. Almost done. You're doing very well. Okay. Just checking this. Right. Okay. Okay. Good. All right. So you can relax your eyes and just blink for a moment. Okay, good. So the optic nerve on both sides is looking healthy, so that's really good news. Okay. I will continue to suggest that you use eye drops similar to the ones that I put in for you at the beginning of the appointment. Okay, that'll just help to keep the eye membrane comfortable, to prevent any dry eyes from forming. Okay. So I did notice on both sides, nothing to be alarmed about, but there is some debris in the eyes. Okay, so if it's okay with you, I'm just going to ever so gently remove what's there. Okay. Okay, so I'll do that by using some eye cleaning solution. So just put a few drops here on this little piece of cotton wool. Okay. Alright. So if you'd like to just close your eyes for me, I'm just going to ever so gently dab and wipe the eye. Okay. 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 Get my little tool here. So if you'd like to keep your eye closed for me, I'm just going to very gently alright. There we go. There we are. Okay, good. And let's do the other side. Just going to wipe gently. Do a little dab, dab, dab. That's it. Okay. Alright, and then I just use my little tool here just to clean out the eye. wipe out a bit, wipe that bit in the corner. Good. Okay. And just close your eyes for me. Good. Okay. And let me get a nice little clean piece of cotton wool. Close your eyes for me. That's it. Good. Okay. Perfect. So, if you'd like to just look up for me, please. Good. And look to your left. That's it. Okay. Look to your right, please. Okay. Good. And if you'd like to look up for me. Again. And look down for me. Look down for me. Good. Good. Okay, good. So let's do that one more time. If you follow my finger with your eyes, okay? So if you'd like to just look up for me. And if you'd like to look down. Okay, good. Look to your right for me. That's it. Good, good. Look to your left for me. Very good. Well done. Good. Just look straight ahead for me. Okay. Okay. Good. All right. So, just wipe your eyes a little bit more. Seem to be weeping on the side. Now that's quite normal after the treatment that you received. And I would recommend that at night, if you wish, to continue wearing your comfort eye mask. Okay. Just to allow your eyes to get some good rest. Okay. Would you like me to place the eye mask on for you before you go to sleep? Okay, no problem. So I wish you sweet dreams and sleep tight, and I will see you again soon.